Hello.
Hello.
I think I'm burnt out.
Yeah, same
Yeah. Yeah.
for
There's
sure.
just, I think that's something, we talk on if you went on the internet, you'd find probably adrenal fatigue, and adrenal fatigue doesn't exist, but burnout does. And I think, the sentiment I hear from people in their job and people who are parents is that they just feel like it's a lot. And I think as women, we're always dealing with a lot.
100% all the time.
Yeah.
It's funny when we
So,
were we were talking this morning, just via voice notes, as we always do, starting anytime after 6 a.m. Um, and it's funny because I know you were sort of saying with respect to your career, talking to another naturopathic doctor colleague about just some of the things you're like feeling, experiencing, and stuff like that, and that's sort of something that she brought up, and then sort of defined it, and I thought about it. And to be honest, there's like a lot of people on social media that like throw around these terms, and I've never really thought that much about it or thought about like putting a name to it. And I was sort of describing to Dr. Laura, and I was like, man, that sounds like factually accurate and how I have been feeling as of late as well. And I sort of explained to Dr. Laura, like, I'm somebody that tracks a lot of like health metrics because I want to because I want to and I want to know, and I think it can be valuable, including sleep and heart rate variability and other resting heart rate. Like a lot of these things will give you like a readiness score in terms of and stress management score that's extrapolated from this data, right? And I was saying
mhm.
like objectively from a lot of that data, like I'm fine. Like I sleep well. I always get a good sleep score. I have a really good heart rate variability for my age and all of those things. But like I was saying that like every day for the last like week and a half, I've like had to go to bed at 8:30 because like I cannot do anything else. I can't fathom. I just don't have the energy. So like I literally go to bed, and I don't know that that's normal either. And it's
Yeah.
not like a physical fatigue. Like sometimes I
No.
run a running class until 8 p.m. and like I can do it.
Yeah.
Um, and I happen to know that my thyroid and all the other stuff is functioning just as it should. But um, that I thinking about it, I'm like, I think that might be it too.
Well, I think it's the less tangible pieces. Like for
Correct.
anyone listening, there is the parental burnout inventory, and then there's the occupational burnout inventory. And the parental burnout inventory was kind of created, from my knowledge, because it's accounting for the people who might not work, right? Like they stay at home and
For
they're still
sure.
burnt out, and they're probably more so burnt out. But I would urge you to actually Google both of these inventories, and what you'll realize is it's not "I'm tired." For example, some of these questions on the parental burnout inventory are: when I get up in the morning and have to face another day with my child or children, I feel exhausted before I've even started.
Hmm.
I find it exhausting just thinking of everything I have to do for my children. I'm in survival mode in my role as a parent. There's a lot of questions around guilt and feeling like you're not the parent that you used to be, or that you could be, or that you should be. And so I think a lot of this comes up as, mothers feeling shame around the way that they've parented, or the way that they've reacted to their kids. And I think there's this unique blend in our society today with mothers who are parentally burnt out and occupationally burnt out alike.
100%.
And I also think that there is this misinformation about, if you love your job, and we both love our job,
Yep.
it doesn't mean it still can't burn you out. And it's not the patient care. It's not the job. It's not the sitting in front of the people and helping inspire people and
It's
helping.
not.
it's the combination of the pressures and life and society and interworkings of business that you and I have both had really emotional and a lot of conversations and experiences about.
Mm-hmm.
It's about the interactions, that we have in our day to day,
Yeah.
and that we're dealing with on like a very private, personal level. And so
Correct.
it's not necessarily the things that burn you out that are public facing.
Right.
It's a lot of the things that, happen behind the scenes. And I think when you're a person that, as you were talking and you're like, I'm fine, your voice kind of went up. And I was
Right.
like,
Being like, I'm
I
not
was
fine.
picturing,
I'm Ross
I was,
Geller. But what I'm
I was
saying is
picturing,
a lot of people, I think a lot of people picture though, like, there needs to be like diagnosable pathology, I think is what
yeah.
I'm getting at. And trust me, I don't think I'm fine. But like, I, from like a medical perspective, like if I was to go to the doctor, right, my family physician, they'd be like, you're fine, right?
Yeah.
When like, I can tell you this week I am not a fine individual. Lots of stuff going on behind the scenes. Um, and, we live in a society where, people in situations that deserve to be kicked in the teeth, and you're just like not allowed to do that as an adult.
Yeah.
And it sucks because I think sometimes that would correct a lot of things, is if we could just go back to 80s schoolyard rules
Oh yeah.
and just let me go.
Take him
But
down by the hair. I
take
think
them
that's all.
down by the hair. That's what I want to
This
hear.
is not parenting advice.
No, this is not parenting advice.
I
Also,
think
also wouldn't talk to. I wouldn't bring this up to your HR department either. But
no. And
um,
I think also on that note, I think a lot of burnout and we have as women we're wearing a lot of different hats. We
yeah,
have a million different roles, we have a million different responsibilities. There's a lot of conversations around the mental load and the mental load of the birthday parties and the appointments and what do I need for
oh my
this
god, there's nothing I hate more than other kids' birthdays.
and oh my God. And all
Ugh.
of it leads to the burnout piece. And I also think that in society, I think we went from COVID, everyone was like, stay at home, locked in your house. And then we just transitioned and we're like, go right
Right.
back to everything. Everything is full fledged, everything is full on. We're doing everything. And then you also have to deal with all of the interpersonal workings of your life. And, I guess I come back to the like nice guys finish last conversation, right?
Yeah.
It's like you do the things you put in the work, you follow the rules, and we've had this conversation a lot. It's like you can be right,
Mhm.
you can be legally right, you can be morally right, you can be right, and what you're doing is right, and
And you can be doing all of the right things in your health too,
yeah,
right? Like
yeah,
on paper, you can do all of the right things, and sometimes things still go awry. And I think
yeah,
that's hard for a lot of us, and where a lot of that burnout comes from, right? Is
yeah.
because there's a lot of situations outside of your control. It was funny. I just before Dr. Laura and I popped onto film, an OBE called me regarding a surgery. And if we need to loop back to a couple of episodes in reference, I don't know if you guys remember when Ashley and Laura talked about Ashley's dermoid cyst. The type of
Hmm.
cyst that can contain hair and teeth and stuff like that. Well, I
Yeah.
have one that contains fat that's like the size of Neptune on my
Ooh.
left ovary. And, we've done all the testing and we're trying to figure out a surgical date in which to remove it. When I tell you, this has been like solving a Rubik's Cube. So they're like, can you come in next week? And I was like, no, actually, I run a business and I need to make sure my business partner is there, able to take on my classes. Someone has to look after my son. I need a drive. And they were just kind of like, okay, like, can you like figure it out? Because we have to remove this because the risk of ovarian torsion, because your cyst is so large, is very there, right? And that made me reflect on my life, and I'm like, if I need like, if it's a Rubik's cube for me to have a necessary procedure for my own health, like I think that's a problem.
Yeah. Yeah. And
Yeah.
I think we're just always taking on too much and always doing too much. Not we, I mean, we as a society, it also
Yes. I
also
mean,
we,
you and
but
I as individuals do too, but like,
yeah.
yes. Yeah.
Yeah. And so I urge people to take a look at, why you're feeling, because you might be feeling a type of way and you're like, well, I don't feel like I have depression per
Right.
se. And I don't feel like physical low energy. Like I'm not dragging my body and I've had the blood work and my thyroid's fine. You're like looking up. I would urge you to consider evaluating your lifestyle and looking at those burnout pieces. And I also think that really looking at the types of interactions we're having with other people in society is important as well.
Yeah.
Because if you think about all of these silent things that you are unable to speak about, that you are going through on any given day, I always try to think about, what are other people going through silently that they
Yeah.
are not speaking about or they cannot speak
Right.
about. And
Yep.
that adds a layer.
100%. And it's a real conversation and layer in our world in women's health, right? Because some people come to us and they're not exactly sure, like, is this a medical thing? Is this an emotional thing, an environmental thing? What is it? And oftentimes it's the us's of the world that are, just having these open conversations about how people are feeling, validating their feelings, and trying to determine, what are the contributing factors. Is this a medical situation, or is it something a little bit different?
Yeah, and I had a patient yesterday actually. She's like, I feel like, are you a therapist? Because I feel like the things that we're talking about, because
Not licensed.
I I think at the end of the day, the things that we're talking about, it is a holistic picture. It is the fact that, you're like my toddler is in a big boy bed and is not staying in his bed.
Right.
And that is contributing to my inability to have a proper full sleep. And then I wake up already burnt out and crusty, and I'm mad at a 3-year-old,
Right. Right.
and it's like, that's not normal.
Right.
But I feel resentful that I'm like, wow, I haven't slept fully in weeks. And, that has to do with the fact that I might go into an appointment and say, and my PMS is worse this month.
Mhm.
Or my period came early, and they're like, okay, well, what's going on with your life? Well, my toddler's not sleeping. So I'm
Right.
stressed about that. Right.
Yeah. Totally. And
So,
I know you've witnessed this on my end as well. Where, like, my for those that don't know me or know what I do, I have a women's health clinic here in Simcoe County, but part of our business is actually like a boutique women's strength training gym. And I run some evening classes, and in my evening classes, I don't have childcare, so my son comes with me. And the way I want to catapult myself through drywall at
yeah.
times for my 5-year old's completely normal 5-year-old behavior.
Yep.
And you feel guilty because you're like upset that he doesn't understand that this is what his mother does for a living and she's working. But
Yeah.
like, he's also just a 5-year-old sitting in a gym that has foam rollers and balls that you can knock into foam rollers and do all these fun kid things. And again, is it normal to be upset with him for that? No, no, he's a normal 5-year-old, but like, does it interfere with my ability to do my job? And my attention is now split between parenting and working? Yeah, it does.
Yeah. And feeling, disconnected as a parent or feeling resentful as a parent can be a layer that comes on from having an occupational burnout. Again, not because you don't like your job, but because
Mhm.
there's a lot of pieces
Right.
from building a business, leaving a business, building a business, and dealing with all of the pieces in between those things.
100%.
Um, create a lot of life stressors. And so we just really wanted to open up this conversation today because I wanted you to consider whether or not your symptoms were something a little bit more. And I wanted to put this idea of burnout because I know, again, people see adrenal fatigue, but adrenal fatigue is not a diagnosis. And although treating burnout can be a lot of herbal therapies, can be a lot of nutrient therapies, like I know myself, I'm being treated with that, but it's unfortunately, it's a lot of like really taking a step back and looking at your life and looking at your demands and starting to really critically analyze that and say, what do I need to let go of?
Yep.
It's not just about like, Ashley saying going to bed at 8:30. I said to my husband this morning, I'm not tired. but I'm tired. You understand what I'm
Yes,
saying? Like,
yes, and that's a
I'm
weird thing
just
to describe.
I wake up and I'm like, my body feels good. Like
Right.
but I'm like, I'm not yawning. I'm
No,
literally just like, ugh.
like
And I said
exactly,
to my
that's exactly
husband,
it. Like I could go run 5K.
yeah,
I could do that. I have the physical energy to do that, but it's like a mental fatigue.
yeah. And I said to my husband, like, I just want to sleep and not, get disturbed. And he's
Mhm.
like, go to bed at 7. I can't go to bed at 7.
Yeah,
Like
it's not really biologically programmed for that.
there's like a threshold, right? Like I'm not going to bed at 7. And so I think
Right.
that's what the core issue is. There's not enough hours, there's not enough days, there's
Mhm.
not enough time. We're all stretched so thin. And
Right.
then we come back, we wonder why our mood's crap, our period's not good, our sex drive is low. And I think if we just look, like you and I had this conversation this morning, if we look at the things going on with our life, um, there's a lot of moving parts.
Yeah.
There's a lot of things that we can kick to the curb,
Right. And I think
right in
there's
the teeth.
yeah, like and the fact of the matter is, and I know this is the case for our patients too, and this is why we're having, it's a little bit of a different episode in that the type of information we're delivering, but we know that you guys are the same way in that, there's certain people, places, and things that I knew if I could just, burn it or burn them down, I would have a lot less stress in my life. But we know that, like, for legal purposes, that's a joke. But we know that we can't actually do that. And I know that's the same for my patients too. Like, a lot of people are like aware of the situations that are toxic and the people that are toxic, but some people make it really really hard to get rid of them, right? And there's certain people you can't just eliminate from your life. Like, you can't kill your mother-in-law. You just can't do it, right? We have laws against that. So, managing the manageable, right, it is a challenging thing to do.
Yeah, totally.
Yeah.
Totally. So this is a shorter episode. So I hope you guys, this conversation sparked something within you and you're able to take this information. And we'd love to hear from you on our social medias,
Yep.
and comments in the podcast. Like we would love to hear from you, on what your thoughts are. And so, next week will be a little bit longer, but today we just wanted this short conversation to just kind of put it out there and know that, we're with you. All
Yep.
right. Awesome, guys. Bye.
Bye.